name's Christine Santos. I'm a nurse at St. Anne's Hospital. And St. Anne's Hospital just went live yesterday on July 7th with Advanced Clinical Systems. Advanced Clinical Systems is a new system that we're using for patient documentation to provide safer and more quality care to our patients. I'm going to do a quick example of what a nurse would do when she starts off her day. So I come in the morning and I'll pull up what's called a status board. And the status board is going to have all the information about my patient, which will have the patient's physician. It'll be able to show me any new orders that are written on the patient and any results that are written on the patient. I don't have to go back to the nurse's station now to look for results. I can just actually get the results when I'm in a patient's room at the bedside with the computer. So it gives me up-to-the-minute information. It also gives me information such as the code status on the patient, any treatments that I have to do, and what the chief complaint of the patient was, so what they came into the hospital for. So it's all right at my fingertips. It also tells me if the patient has had a fall risk, if they're on any nursing precautions or infection control precautions. It also gives me any teaching that I have to do with the patient that complies with JCAHO regulations and our national patient safety goals. It also tells me when I'm going to have the next scheduled medication due and the patient's diet. After I log into the system, I can go into what we call interventions. And when you log into interventions, what happens is that you get a whole list of all the interventions that you need to work on for that patient. Each intervention is listed with a frequency, which can be changed by the nurse or by physician order. And those are all just the different assessments that we use to care for our patients. After we work on our interventions with our patients, the next thing that we do is we go into our MAR, which is our medication administration record. And that is where one of the best safety features comes in, because what happens is that our patients, we now scan them. So we're checking the 5 rights, and we're also going to the bedside, looking at the patient's wristband and scanning that patient's wristband. When we scan that patient's wristband, a little prompt will prompt on the screen, and it'll say that the patient's account has been verified. So this way we know that we're giving the medications to the correct patient. Then each of my medications, after I've scanned that patient's wristband, each medication I'm going to take out and scan to ensure that this medication is for this patient. And that is one of the best safety features I feel with the system, is that there's so much of a less chance of error, because they will not allow me to give medications on a patient if they're not ordered for them. Patients can see their nurse so much more now, because instead of, I guess, one of the biggest complaints about from patients is that they don't get to see their nurse often enough. They always feel that the nurses are sitting at the nurse's station documenting. And with the new system, your nurse is going to be right with you at the bedside. She's going to be talking with you as she's doing her assessment on you. She's going to assess you, and then she's going to enter the assessment right into the computer system. The medications will be done all at the bedside. Everything will be done at the bedside with the patient. So it's a lot more of getting back to that caring process, which especially we have at St. Anne's Hospital, the Cartias caring process. And it brings us more back to the bedside, where we should be with our patients.